Hey there, and welcome. If you're on a long-term psychiatric medication, you're on a journey. And just like any long trip, it's a really good idea to pull over and check the map every once in a while. That's exactly what we're going to do today. We're going to talk about why taking a fresh look at your medication isn't a sign that something's wrong, but actually a really powerful step toward feeling your best. So let's start with the one question that usually kicks this whole thing off.
Have you ever had this thought pop into your head? Is my medication still right for me? It's a question a lot of people have, but for some reason, we often hesitate to say it out loud. You might be wondering if things could be a little better, maybe a little different, or if the treatment that helped you so much in the beginning is still the best option for you now. And I'm here to tell you, that's a completely normal and very important question to be asking.
And maybe for you, that big question sounds a little more like one of these. Are you dealing with those nagging side effects like always feeling tired or seeing changes on the scale? Or maybe you just feel kind of flat, emotionally numb. Or you're just not sure if the medication is even doing its job anymore. These aren't just random feelings. They are super important signals from your body telling you that, hey, maybe it's time to have a conversation.
Here's the challenge. It's so easy for treatment to just become routine. You pick up your prescription, you take it every single day, and then the years start to fly by. But here's the thing. Our mental health isn't static. It changes. So our treatment plan probably shouldn't be set in stone either.
This is probably the most important takeaway. Good psychiatry should never, ever be a set-it-and-forget-it kind of deal. It's supposed to be an active, ongoing partnership between you and your doctor. The whole idea that you can get one prescription that's going to work perfectly, forever, with no adjustments, well, that just doesn't line up with the reality of how our brains, our bodies, and our lives evolve.
So when is it really time for that check-in? Well, there are a few key signs. A big one is if you've been on the exact same medication for years without a real sit-down reevaluation. Or maybe your prescription came from your family doctor, not a specialist. It's also a really good idea if you feel like you've just bounced from one medication to another but still don't feel quite right. And this one is huge. If you're thinking about stopping your medication, you absolutely need to have a conversation with a professional to do it safely.
Which brings us to the main event. What even is a medication review? It sounds kind of formal, maybe even a little intimidating, but it's really just a focused conversation that is all about you. Let's break this down for a second. The words that really matter here are collaborative, comprehensive, and aligned with your personal goals. That's so important. This isn't about a doctor just telling you what to do. It's a team effort. It's a partnership to make sure your treatment plan is actually working for you, based on who you are and where you are in your life right now.
So try to think of it like this. It's a path to clarity. It's a way to clear out all the fog and uncertainty and just make sure you're heading in the right direction.
And this path to clarity usually has 4 key stages. First, it kicks off with a really comprehensive assessment of your whole story, not just a list of symptoms. Then, you'll dive into a detailed review of your specific medications. From there, you'll work together to build a personalized plan. And finally, and this is so important, it includes safe, ongoing monitoring because the follow-up is every bit as critical as the plan itself.
Okay, so that's the process, that's the how. But what actually gets talked about in one of these reviews? What are the big questions that are on the table?
This is where the conversation gets really interesting. A specialist is going to look at effectiveness, for sure, but they're also looking at the bigger picture. Are there newer, maybe even safer options out there that didn't exist when you first started? Is this medication still the absolute best choice for your specific diagnosis today? And maybe the most important question of all, could other things like therapy or even nutrition help you reach your goals even better now?
And that brings us to a really critical point. The outcome of a review isn't always a new prescription. It's about figuring out the right overall strategy for you as a whole person. The possibilities here are actually pretty broad and totally personalized. The outcome might be something as simple as slightly adjusting your dose to get rid of some side effects. Or it could mean switching to a more targeted medication. Maybe it's about adding therapy into the mix. For some people, the goal might be to create a safe, gradual plan to reduce or even stop their medication, and sometimes it's just about simplifying a routine that's gotten way too complicated over the years.
Because at the end of the day, that's the real goal, right? It's not about just getting another piece of paper with a prescription on it. It's about finding a sustainable path to feeling stable and clear, giving you that confidence and control back over your own health journey.
So, with all of that on the table, let's circle right back to you. How do you know if maybe you're due for one of these check-ins? Here's a quick little checklist you can run through. Ask yourself, have I been on the same med for years without a real review? Have things in my life changed in a big way recently?
Am I dealing with new or just ongoing side effects that are bugging me? Or do I just feel kind of stuck, like my progress is stalled out? If you're nodding your head yes to any of these, that's a fantastic reason to start a conversation.
It really all boils down to this simple truth. What worked 5 years ago may no longer be the best thing for you today, because your brain, your body, and your life have all evolved. Our lives don't stand still, so it just makes sense that our treatment plans should be able to change and grow right along with us. So we'll leave you with this thought. Deciding to review your medication isn't about second-guessing the past. It's about investing in your future. It's a single conversation that could lead to fewer side effects, better results, and a whole new sense of clarity. The only question left is, what could that conversation unlock for you?